Hi everyone, welcome to lesson 12, okay, of the Medical Care Organizations course. In this lesson, we're going to go through cost, access, and quality. Okay, so there are three cornerstones of healthcare delivery, and I know we mentioned this in the very beginning of the course, right? So cost, access, and quality are these cornerstones, and they're all they're interrelated, okay? So high quality care is the most cost-effective care. Cost is important in evaluating quality. Okay, so that's how they are very related. Okay, they're interrelated because cost is probably a great way to evaluate quality, especially today. We usually think of when quality goes up, the cost is going to go up. But when it's cost effective, we would want, the goal actually is when care, the quality is high and the cost is lower, or the cost is less, okay? So accessible, high quality of care is achieved when there is access to care, okay? And when they're efficient, they're working properly, when it's cost effective, so it's not as expensive, and it's provided in an acceptable manner. Okay. Now, looking at cost itself, there are three meanings for cost. Okay, so first we have price. We're going to look at, you can look at cost as a price, and if you use this perspective, you're looking at it like as a prescription bill. You're looking at healthcare as like on a physician's bill. Okay, after a physician's provided services, these are the, like this is what I did for you. This is the price for each treatment. Also, you can look at it, if you look at it through the perspective of price, you can also look at premiums. Okay, the premiums that you pay to the insurance company. Okay, every month, or that your employer pays to the insurance company for your health insurance. Then there's another perspective that we can use to look at cost. Okay, so this will be the national perspective. So how much is healthcare costing the country? What are the healthcare expenditures like? You're looking at it like a macro level. Okay, you're looking at all the money that we're spending on healthcare as a whole country. So from this perspective, it's like every little thing adds up. Okay, so more systems instead of just individual things. Then you can look at it through the provider's perspective. Okay, when you look at it through the provider's perspective, this is like the physician's practice, or maybe the person that owns a hospital, or something like that. And you're looking at it through the cost of production. Okay, so we're looking at cost as like how much it costs a hospital to staff a room, or a bed for, potential patient, an inpatient, or how much it's going to cost like a particular physician from some practice to provide enough resources in healthcare for, this one treatment that they're providing for their patient, things like that. So what would be included in that would be like supplies, staff, equipment, things like that, all the technology that you have to use, and all of those cost money. So there's the provider perspective of cost as well. Okay, so trends in national health expenditures. Okay, so the United States uses a larger percentage of economic resources on healthcare. Okay, healthcare is probably one of the biggest things that we spend money on as a country. And in 2009, just to put this in perspective, in 2009, this is a little over a decade ago, the GDP, or almost 16.99, or almost 17% of the GDP was spent on healthcare. So that's equivalent to spending pretty much $7,000 on each person that year on healthcare. Do you guys spend $7,000 a year on your healthcare? Anybody? No, I don't either. I mean, maybe a few of you do, or, but a lot of what's going on in healthcare is we're just spending so much money. There's just so much waste happening. And of course, we have to care for certain people who are, certain people do require a lot of expensive healthcare, but at the same time, some of their care is also, or what we should have done with them, and it's kind of a result of how our system is, but we should have focused more on preventative measures and primary care and maintaining them instead of allowing their, illnesses to get so bad to where they cost a lot of money to care for. Anyway, so in 2015, it was projected that 20% of the GDP was going to be spent on healthcare. Now, did that actually happen? No, it didn't. Okay, we did something right because it was projected that we were going to be spending 20% of our money on healthcare because it seemed like that was the rate at which we were moving. But we since then we have incorporated a lot of measures. That is also when the ACA came out and was, well, it came out in 2014, but it started to really be implemented in like 2015 and 2016 and whatnot. So we started to spend less and less and kind of control costs a little bit. Okay. So in 2014, okay, we spent 17.14% of our GDP was spent on healthcare. So it wouldn't have hit 20% that quickly. Okay, it didn't even go up a full percent since 2009. So definitely did not hit 20. I don't know if it has actually hit 20 yet, but it's possible that we have started to do something right. Okay, so, but why do we even need to contain costs? Okay, so here are a few reasons for why we would need to contain the costs, why we need to reduce our healthcare expenditures and not spend so much money on healthcare. I'm going to go over or highlight a few of these, not every single one, but all right, so let's go over some of the reasons. So reasons to control costs. Healthcare consumes a greater percent of the total economic output. Okay, resources are limited. We don't have infinite resources. Okay, and when we spend all of our resources or put all of our resources towards healthcare, then there are other resources that we need, to have our society functioning properly, that we're kind of curtailing, we're cutting them out. Okay, we're not really, we're pushing those out and we're putting more of our resources towards healthcare instead, or we're taking resources from other countries, okay, and keeping them for ourselves, for our consumption, okay, because the world does not have infinite resources. If we have all the resources, then other people do not have those resources, okay, so we should not be as wasteful with our healthcare, especially because we are spending a huge amount of money on healthcare. Okay, and so we should be limiting our resources to just direct them to the highest value. What is most important for us to be spending, a lot of money on, and what, a lot of our resources on. And it's not. Healthcare is very important. It's up there, but there are other things as well that go along with healthcare that are very important for our society. Okay, that we need, we do need those resources. So public spending for healthcare will become unsustainable. Okay, eventually, if we keep going the way that we are, if we're not cutting back in some way, or we're not sort of redoing our system, we don't reform, we would not have enough public spending to sustain everybody. Okay, and keep in mind, we have many people that are going out of the workforce. Okay, the baby booming generation, they're starting to, a lot of them are leaving the workforce, they're retiring, and then also they're more vulnerable to having chronic illnesses and other things going on with them. And more than likely, and since we do have like a longer lifespan now, they are more than likely going to be they're going to go into the long-term care system, and they're going to be there for a long time. Now, will our Medicare and Medicaid programs be able to sustain that as well as everybody else? I don't know. Okay, so if we don't start to sort of reform what we're doing, then it may or may not be sustainable in the future. Okay, so reasons for cost escalation. So what's driving up our healthcare costs? Okay, so cost inflation can be influenced by third-party payment system. Okay, this is what we have with our third-party payment system, and this also it ties into the same thing, our third-party and multi-payer system, compared to a single-payer system like the other countries like Canada, Japan, England, all those other countries where they have a single-payer system, and that single-payer system is usually the government, or it's a government mandated, like, insurance that is there to help and pay for everyone's basic health care. Okay, so, and it also actually let's move forward because we're gonna break this down. So third-party payment system, because we have this third-party payment system is like the separate insurance company. The insurance company is the third party, and what insurance does, it really insulates the provider and the patient. Okay, insulates the physician and the patient. The insurance company is like this nice little insulation, okay? And then here's the doctor, and then here's the patient. And it kind of protects both parties, right? They're able to take as much money as they need because the patient is going to pay them their premiums, right? And then when the physician provides whatever services, because the patient's not really worried too much about how expensive things are as long as the insurance pays for it, so it doesn't really care. Okay, they don't care, and many times they don't really question whether or not something is even necessary. Okay, whether a certain diagnostic exam or a certain treatment is even necessary for them, because the insurance is going to pay for it. As long as the insurance covers it, I'm good. The doctor knows what they're doing, they know what's wrong with me and what I need, and the insurance covers it, I'm unaffected. Okay, so the patient's unaffected, or, well, not so unaffected, because usually the physician is able to induce the demand for their services, and the physician's able to sort of manipulate the patient into buying into the fact that, like, hey, this is what's wrong with you, this is what you need, I need to do this for you, and but the doctor is usually playing the patient, because the doctor knows exactly what the insurance company will pay for. Okay, so the doctor's going to be like, okay, well, I'm going to diagnose you as such and such, and I'm going to collect this money for this treatment that I know the insurance company will pay for. Okay, so, and they're just totally insulated like that. The doctor doesn't really have to compete so much with other providers, so much so because the insurance company usually gives a list of providers that the patient can go to. Okay, so the insurance company also is going to refer patients over to the physician. So it also cuts out a lot of competition there. So insurance companies, they insulate. Okay, the third-party system totally insulates the patient and also the physician. No one really feels any kind of effects of this market. Okay, so the patient doesn't really feel like they're broke trying to pay for their health care, nor do they really care. They just want the best service and they want whatever treatment that they think they're supposed to get. And the physician over here is going, they're also unaffected. They don't have to really compete fiercely in the market for too much of their business, because what they can do is they can get insurance companies, they can get managed care organizations, they can get, you know, all these other companies to bring them their patients. And then since those patients have to see that doctor, well, there's really no competition there then. Okay, they're given the patients, and so the physician knows what the insurance company or the managed care organization is going to cover, so the physician can kind of play with that and be like, okay, so these are the different things I can do with you, these are the different tests I can run, these are the different you know, treatments I can give you, and this is what's going to be paid for, so let's go down this road. Okay, so anyway, as a result, we get moral hazard, okay, because the patient's being exploited in this situation, and there's waste, okay, and also the provider gets to induce the demand for their services. Okay, that's as a result of the third-party payment system. The waste, of course, as waste, I'm referring to the money that's spent and the resources, the stuff, the supplies and everything that have been spent on caring for the patient that may not have been necessary. Okay, so also next, another reason for cost escalation is the fact that we have this imperfect market. Okay, remember we have this quasi-market. It's not a nice, you know, free market. It's not really controlled by supply and demand, because there's so much interfering with the physician to patient interaction and things like that. So we have neither a free market, nor do we have a very highly regulated art market either. And this allows for prices to just go crazy. Okay, providers can charge whatever. Pharmaceutical companies can make medications extremely expensive. And all of that, you know, we have those huge problems, and it's all a result of having an imperfect market, because since we have this imperfect market, all these organizations are allowed to do the crazy things that they do. Okay, so next let's look at practice variations and small area variations. So this is quite interesting. So they found, okay, as you know, a result of many studies and surveys and whatnot, they were able to find that in some parts of this country there are areas where like cities and you know, counties, towns, whatever, there are areas where there are major gross inefficiencies in the system. Okay, where some areas will be spending so much money on healthcare, like most areas will per population might stay around the same, like stay at this level of, okay, of, you know, costs to quality. Well, we have some areas in this country where they will be spending a lot of money on healthcare, and there's really, when you check in to try to figure out why is that, why are we spending so much money on healthcare, you would think that maybe the reason why we're spending so much money on healthcare would be because maybe those areas are providing amazing quality. Okay, maybe their quality surpasses all the other surrounding cities and counties and everyone else in the country. So they're providing amazing quality. That's why it's costing so much. You would think something like that, right? No, because when they check, the quality is just the same as everything else. They're just spending crazy amounts of money. So there's clearly a lot of waste and a lot of maybe discrepancy, maybe a lot of fraud happening in those small area variations, okay, compared to everyone else. So that's another reason for cost escalation. So here are a few more things that are driving our cost, our healthcare expenditures. Okay, so technology and specialization. Okay, research and development. We invest so much money into research and development. We've already talked about this a lot, and so that's a huge thing that, I mean, obviously investing in research and development costs so much money. Okay, coming up with new technology. This technology is not cheap, so that's going to cost a lot of money. Paying the researchers and the physicians, the specialists and whatnot, that's costing a lot of money. And of course we have that, when we're investing a lot into our training in our medical schools and our research and development, there's a lot of encouragement and a lot of influence that causes a lot of people to become specialists, okay, and know how the more specialists we have, the more specialty care we we provide for our patients, and of course that drives up healthcare expenditures because specialty care is so expensive. So is technology. So medical technology, when we have a lot of new great medical technology out there, usually it's going to be a lot more expensive and it's going to really drive up our healthcare expenditures. We're going to spend a lot of money on it. Okay, so next, increase in elderly population, and we touched on this also like earlier on in this video. The elderly population, or the older adults in this country, the baby boomers, they're getting older now, and it's a huge population. This is the first time in our nation's history where we had so many people retire at the same time. We've had one gigantic generation who has a higher lifespan, who is going into retirement, who does not have the best health either. So they're going into retirement, and many of these people are going straight into to start receiving a lot of long-term care services as well. And of course, when they're going into retirement at around 65-ish, 65 to 70, they're going to have a lot longer lifespan. So this means that they're going to be on long-term care services, and they're going to be using a lot of medical care for a longer period of time, longer than the previous generation. Okay. All right. So more reasons for cost escalation. Just the whole medical model that we use. Remember, we use the biomedical or the medical model of health in this country, and we like to emphasize our focus mostly on physical symptoms. Okay, so when we do that, and we don't like to focus on prevention, we don't really like to focus too much on primary care, and we sort of just wait until we have terrible physical symptoms. And then when we do have physical symptoms, we like to alleviate those symptoms only. We don't necessarily want to figure out why it happened, how we can prevent further decline, how we can, even restore functionality, how we can stop the thing that's actually wrong. Okay, so that's not really how our medical model works. We are kind of moving in that direction, or we're trying to push it, and a lot of people out there are trying to push for a better medical model. But right now, the medical model of health is what we use, and that's what a lot of like our physicians focus on, the biomedical model. Let me help you with your symptoms. That's what it's all about. So that, of course, is going to drive up healthcare expenditures, because when we're not focusing on preventing things from even happening, when we're not focusing on, if something is going on with us, that we keep it, that we're not focusing too much on early detection and, preventing any kind of further decline or stopping a disease before it even goes very far at all. When we do that and we just allow things to happen, then once it hits a certain point where it's very acute and it's causing a lot of problems, and then you're probably going to have a lot of problems associated with that, or that's going to come out of that as well. So it's going to get very expensive when you allow your health problems to escalate. So if we can get them well before they even happen, then everything will be so much cheaper, and we're also going to have much higher satisfactions with our health, as a country. So some more reasons for cost escalation. The fact that we have a multi-payer system and high administrative costs. Okay, so we have a multi-payer system. That means we have all these third-party insurance companies, managed care organizations, all these different ways that we pay, and every single different program or plan, they're all different. Okay, there's no standards among them either. Okay, and then so for what's going on with a lot of these is that we have to actually pay more people. We have to have more people employed to handle all the different coding and the billing and everything that's involved in paying and charging for these services that are provided, because we have so many different insurance companies and whatnot that we have to deal with. Some more reasons for cost escalation. We have the fact that we practice defensive medicine in this country, and it's because we like to sue people so much. Okay, so and because of that, many physicians and other practitioners feel they really have to protect themselves, so they may administer medical tests and treatments that are not even justified, but they're doing it to protect themselves, to make sure that, like, look, I did everything. Just they do it for the books. Okay, just look, I did everything. If something went wrong with this patient, it was out of my hands. Okay, so that's really the reason for defensive medicine. Then we have waste and abuse. So there's so many inefficiencies and fraud and things like that, especially in Medicare and Medicaid. And I know a huge reason for that is because Medicare and Medicaid pays pennies on the dollar, so they don't pay much. And if a lot of your a lot of your patients are Medicaid or Medicare recipients, you're going to try to see if there's anything more you can get out of them. So you're going to we see upcoding, which is a lot of upcoding where, this patient was supposed to receive this cheap treatment, okay, but you're coding for a treatment that's more expensive, and that's what you're billing Medicaid or Medicare for. Okay, so you're going to say, hey, we're doing such and such. This is a really expensive one, or you might put a diagnosis that the patient doesn't actually have, okay, so that you'll get paid more. Or so you'll just try to bill for unnecessary services, or maybe services that have not even been provided for the patient, and just so that you can collect as much as you can. So you know exactly what Medicare and Medicaid will pay for, and what the rules are and everything. And if you've been working with them for a while, you know what they're going to check, what they're not going to check. And so many organizations will find ways in which they can scam the system. Okay. So how can we implement regulatory approaches to try to contain these costs in our country? So some things we can do is an all-payer system would help if we had a single-payer system, kind of like the UK, Canada, and whatnot, where maybe the government issued a mandatory health insurance that everyone has to put into, and then that would help and create standards. And that way we would do away with a lot of these unnecessary administrative costs and all these additional costs that we're putting, that our healthcare system is using. We can do away with a lot of these excess costs, okay? And if we have a multi-payer system, then also so we can implement health planning. Okay, so we can use government efforts to align and distribute healthcare resources to achieve health outcomes. So we can have certain objectives and goals for our country, for each year or decade, which we actually do every decade. We have a certain list of objectives for our health that we're trying to achieve, but we can implement better government efforts to really tackle a lot of these health issues that we do have, a lot of our chronic ailments and things like that, and really start to change the way that things are going with our country. Because many of those objectives, those 10-year objectives that we usually try to reach, they don't get, we're usually not successful with them, especially those with like cholesterol and heart disease and a lot of the major chronic illnesses that we suffer with, they're still with us. So if we had better health planning, we invested a little bit more in that, we can probably achieve better health outcomes in our country. We can also offer, put up some price controls. The prospective payment system, they created their own price controls, okay, with Medicare. So we can have up some level of price controls. Also, there are peer review organizations, or PROs, and what these are they're subsidized by the government, and each state has a PRO, or a peer review organization. And what this is they'll hire agencies, and they're usually going to be health professionals, maybe like nurse practitioners and physicians that they hire, and they'll have these practitioners or these professionals go out to all the different organizations and facilities that accept Medicare patients, okay? And then they will actually review their cases and make sure that these organizations are abiding by Medicare's rules, okay? Their standards of health and practice and everything like that. Okay, so access to care. This is pretty much where we are going to stop. Okay, so what I really need you guys to understand about access to care, especially for tests, is that having access is the ability to obtain healthcare services when you need it in a timely manner. Okay, that is access. That is the basic definition of access. Another thing that we should also be mindful of is the fact that, like, the ACA, the Affordable Care Act, focused on access. This is what they mostly did, because they were really out there trying to make sure that everyone had access to healthcare. They wanted, tried to expand all the Medicaid programs in every state, which of course they kind of got shut down a little bit there. They weren't allowed to require it or to force the states to do it, but they did highly encourage the states to do it, and that's how that turned out. But what the government also did was it created programs that would help subsidize a lot of these health insurance companies, the private health insurance companies, so that many of the people who don't necessarily qualify for Medicaid would also be able to have health insurance, but they'll just pay their premiums at a really low rate, okay, in order to subsidize the difference, okay, because most of these insurance companies are usually used to getting paid high amounts for their premiums, for their insurance benefits. The government had to give them money, okay, so that they would be able to lower the prices or the premiums for the other people, okay, the somewhat low-income people. So this really expanded access. A thing that it didn't do, though, or what they may not have really thought about, was that now the insurance companies are going to get kind of mad, all right, and they still had like a loss compared to where they were. Okay, so what a lot of these insurance companies were doing was that they decided that since they can't really charge the lower income people very much, they still have to give them the discounted rate benefits. But what they started doing was they started increasing the premiums and the deductibles on the other people, the more wealthier people, the people who could afford, who technically could afford private health insurances. Okay, they're the ones who didn't qualify for the discounts. Now those people are the ones who started to suffer. Okay, because those people now they had to pay premiums that were excessively expensive, and their deductibles especially. Remember what the deductible is? That's that annual amount that you have to pay in order to even start using your benefits. Okay, the deductibles got so high to where a lot of people who, although maybe they can usually afford it, they're very well off, it got expensive for them. Okay, they couldn't even pay, or they struggled to pay so that they can have access to their health insurance benefits. So it's like the tables turned, and now it's people who have more money who are suffering and not able to have access to healthcare. So it backfired a little bit there. But that's something I just want you guys to know. The rest of this, go ahead and I want to invite you guys to just kind of look through it on your own, but you won't be tested on it. So enjoy, and I'll see you in the next lesson.